with Mid-Same, and we're going to talk about respiratory therapy. Okay, kind of tell me what respiratory therapy is, if someone doesn't know.
A respiratory therapist is a specialty healthcare provider. We take care of patients who, for whatever reason, are having difficulty breathing. Sometimes it's an acute illness, an acute injury, like a gunshot wound or a knifing or an automobile accident. It could be an illness like a pneumonia that causes somebody to have difficulty breathing. It might be somebody who has chronic lung disease, emphysema, chronic bronchitis, asthma.
Okay, now, are these people, once they graduate, are they working out of a hospital mostly?
About 85% of the therapists today will work in a hospital. Other opportunities for a respiratory therapist are in home health for those patients who have chronic illness. So sometimes respiratory therapists are recruited to do medical sales. It's easier to sell respiratory equipment to a respiratory therapist if you have some understanding.
So then 5 semesters and they're done with the program and ready to work.
2 years, 5 semesters. We start in the fall, go straight through until 5 semesters later, graduate in May. We tell our students to consider their clinical rotations the longest performance-based interview they will ever have, and most of them will graduate with job offers.
Okay, so you kind of mentioned it, but job placement-wise, are they going to have trouble finding jobs after this, or?
Nationwide, there is a respiratory therapist shortage. Here in the Champaign-Urbana area, there's always an opening. One of our hospitals pretty routinely has agency, temporary help in-house, just because of the growth for the respiratory therapist in the area. It's a national credential, state licensure, so if somebody wanted to move to another state, that credential would go with them. They would just have to apply for a license in that other state.